Still on. I think I'm just gonna check in with our people here. Which inning is that now?
I think they're still in the seventh inning. I think they just started the eighth inning.
Eighth inning. So it may be some time. It may be faster. It may be longer. But we're gonna start our conversation on YouTube Live and Facebook Live, and then we'll rejoin on the live radio as soon as it's available. And today's topic, quite interesting: how to deal and what to expect from a conventional medical system. Now, that's an interesting topic.
Well, last week we talked about one of the biggest problems in the medical system,
Yes.
the third party.
Yeah, that's right.
And that's when things began to get into real trouble, in my opinion, is when so-called medical insurance, which is the greatest scam in the history of the world, got involved, and then even worse when the government got involved with Medicare.
Mm-hmm.
Medicine before 1940 was better than it is today, in my opinion.
Absolutely.
But it was even better probably before early 1900, when the great Flexner Report tried to get rid of everything except MDs.
Mm-hmm.
They tried to get rid of chiropractic, they tried to get rid of osteopathy and homeopathy, and they succeeded to a great extent in blocking those. But the interesting is, in the mid-60s, the AMA was screwing us physicians, as they always have, since their beginning, by charging us for their lawsuits against chiropractors.
Oh, God.
And osteopaths. And then when the chiropractors finally won their lawsuit in the mid-60s, they stopped fighting at least DOs.
Mm.
And they tried to convert all of them. Now, again, for 65 or more years, they've been fighting osteopathy. All of a sudden, if they wanted to become an MD, all they had to do was sign a piece of paper with no further training. That shows you how crappy the AMA was. Now, then, of course, there was something even worse. Their so-called czar,
Mm-hmm.
I mentioned the name, you can look it up if you choose, tried to gain control of the greatest discovery, perhaps, in the history of medicine.
Mm-hmm.
The use of a microscope to make a diagnosis of cancer and to treat them.
Yep, the Rife
machine
report.
Dr. Wright.
Yeah.
Wright.
Mm-hmm.
And the czar demanded part ownership of the Rife technique, which was fought legally for many years. But anyway, to me, the AMA is one of the most illogical and evil organizations in the history of the world.
Well, let's face it, AMA is the protection racket, so to speak, in the medical industry. If you want to get your CMEs or anything else, you got to go through AMA. But it's a monopoly.
It's a bureaucracy.
It's a bureaucracy as well.
The minute you become a bureaucracy, you suck.
Mm-hmm.
And that's being kind as I can say in public. But if you really want to know about it, you have to talk to me privately.
Yes.
Okay, so I gave up as much contact with bureaucracy as I could in 1971. I'd had it with medical schools, universities, hospitals, the medical profession in general. And that's when, on October 15th, I said, I'm going to try to do this without any religion, if you will. And that, because there's a religions. They're worse than the average worst religion in the world, trying to control everything you do. And I've done it pretty well for, soon be 50 years.
Well, you're indeed the pioneer, one of the first people to start the holistic movement. And by the way, the holistic movement, ever since its beginning, has been buried to a large degree, not fully because we're still around, but just for folks out there, we mentioned, I think last week, there's a holistic organization, American Holistic Medical Association, but they changed.
They gave up their name.
Yes.
And if you give up your name, you're giving up your birthright.
Mm-hmm.
And to me, the case of integrative, it's just stupid.
So let's talk about the
system.
The system as it exists. Yes.
At the current time, you almost have to have medical insurance. to survive financially.
Exactly, and that goes back to the discussion that we had last week, which is, and it's still an ongoing situation in my life because a small example. So I had a back surgery. Now, if what happened has happened, I'm not can say anything about that, but I can certainly talk about the insurance and the medical factors. If you don't have a good insurance, if you don't have a conventional insurance, you are basically you're in trouble, because what the hospital does, and again, this whole thing is a racket. The whole damn thing is a racket. So go ahead, please.
Well, and the unethical leftistas, and if you don't know who that is, you probably are not listening to this show, but the leftistas this week announced that they're going to try to pass a law that to get Medicare, to have your Medicare, you have to be vaccinated. And I will give up even Medicare if I have to do that.
Yes, sir.
There's
Absolutely.
no way would you could give a vaccine into this body.
Thank you for mentioning that. That's absolutely. Thank you. I didn't know that. But let's just talk about the overall big picture of the medical system. And these things are coming out almost every day. Something new, a new development, and they're not always for the best. If you're if you love your healthcare freedom, if you love to be able to do what is right for you, I'm not going to go there. I promised
I don't know when the pharmaco mafia took over.
Right.
But they did.
Yeah.
I don't think they had taken over significantly when I was in medical school. But somehow, especially after the government got involved, 1965, I think the pharmaco mafia and the government working together took over, period.
And interestingly, I want to mention to the folks out there who are dealing with a conventional system, conventional folks. So let's say, for example, there are several aspects to be aware of. There's financial and logistical and bureaucratical. In other words, you got to have a referral to see a doctor. You got to go through other doctors. You got to go through a gatekeeper, which is terrible. Which is, that's one of the main reasons I do have a family medicine certification, but I can't say in words what I want to say.
It allows you to work.
It allows me exactly. The concept behind, I don't want to be a gatekeeper. I don't want to keep people away from what they need. I want to help them get to where they need to go. That's number one. But let's say I just want to give a case and scenario, an example, because this is a very common question that people ask. A lot of the healthcare professionals, but not even the professionals, doctors and nurses or otherwise, are basically there's the hospital policies, there's the governmental policies, there is CDC and all these policies that are coming down the pipeline from the top down. And so in order to keep their jobs, many of the healthcare professionals, from doctors to nurses' aides, they have to basically follow the script and they have to do what is being told to them. Otherwise, many of them will either lose their jobs or else, even worse, whatever worse is. I don't know what that is, but I'm sure it's possible. And so what do you do? What does a person do, average layperson, when you're faced with a situation, let's say, and this could be any topic, like a statin drug. Let's say your cholesterol is just slightly above, and your doctor keeps pushing a statin drug on you. By the way, how do you feel about statin drugs?
Well, the average American is taking a lot.
That's right.
A huge number. And I don't know any drug in the world, ever, especially now, which does not have so-called side effects, including death.
Yes.
Again, my favorite story about that is aspirin. Even in 1960 and before, aspirin, back while I was in medical school, which is 52 to 56, we were told that 16,000 people died every year from taking aspirin. Really. Now, I don't know how many died from aspirin, and it's also its cousins, if you will, the ibuprofens and the Tylenol.
The non-steroidals, NSAIDs.
But they also can kill you from bleeding from your gut, as well as destroying your liver.
Exactly. But there, of all the drugs, and we talk about this all the time. That's one of the reasons why we exist as an organization. We get people off drugs and off side effects. But let's say how does an average person, I do want to cover this at least to some degree, is how do you say no, or how do you voice your opinion? How do you make sure that your voice is heard if you happen to disagree or not necessarily be on the same page as the provider who has an agenda, whether it's their agenda or whether it's the agenda of the institution or the policy? And that's a difficult situation. And I still work in the hospital, and actually having been a patient recently, and having been a provider, I've seen both sides of it, and I just want to let people know, let folks know out there what your rights and options are. So first of all, and this is a common question in our clinic, your medical records, your information is your property. It's your right. You have the right to collect that, to share it, or I should say, to keep it, to share it with the other doctors whom you may find a better relationship with, or you want to just basically second opinion. So, but the one thing is that is your fundamental right. Another fundamental right that we have, and I'm going to say this out loud, is the right to healthcare confidentiality. Nobody can stop you on the street and ask you about your medical stuff. That's a fact. That's a felony. That's a fact. Now, okay, number two, it's called HIPAA, confidentiality and otherwise. Number three, if a doctor happens to disagree, or a nurse or a provider happens to disagree, or start a conversation that you are not comfortable with, like for example, if somebody were to talk to me about taking a statin drug, how would I go about that, as an example? So it does not have to be a confrontation. The first question to ask and to realize, what is happening in the system? What is the system? And if once you become aware that most providers are basically following scripts and protocols, and if they don't, they're going to lose their job. So they have to dot their T's, dot their I's, and cross their, or whatever the expression is, T's. So they got to follow the system, and they have to have an excuse or a reason to get out of that requirement. So what I do is, and this is what I did as a patient, is and I was offered to do several procedures, and when I received bills that were tripling and quadrupling at any given time, I said no more, please, and I need to resolve and figure out what's happening with the billing first of all, foremost. I had to put it this way: I went to the provider, or I sat down with the provider and I said, okay, I understand you have a job to do. I understand you have job and responsibilities, whether it's personal or whether it's a requirement. But I just want you to know, I want to ask you, if I feel different than you, or if I have a different opinion, will you honor and will you respect my opinion as a patient? Are you willing to do, this is a key phrase, I want everyone to even write this down, mutual or informed decision making. What does that mean? Mutual or informed decision making means that a doctor can recommend you anything under the sun. It could be a good thing, it could be a not such a good thing for you. And if you know who you are, if you know what's important and what works for you, you can make a decision in judgment. You have a choice, and you have the right to be a partner in your healthcare decisions. Meaning that if for same example, if a doctor wants to, if I go to a doctor or a provider or anyone really, and they want to shove something down my throat, like for example, like a statin drug, which I don't agree with. There's many other examples of things that are being forced on people. Forced and so on and so forth. How do you say no? First of all, get the information. Why do you want to take me and give me this thing? What is the benefit? What is the risk? Can you give me the information, the data? Can you give me the research? Most providers will stop right there. I'm just going to tell you that, because most of us, basically in the healthcare system, we're just following what we're taught. We are basically like parrots regurgitating information that is passed down from above. I don't mean it in a bad way. And I'm not saying in anything negative. Some of us are very bright out there, but some of us are still very much restricted, bound by what the organization and government and everything else mandates. So give the doctor or provider a reason or excuse or a way out. Informed decision making. That is the key. Thank you. I appreciate your suggestion, but I would like to do this my way. Are you willing to work with me? Are you willing to see me as a patient despite our difference in this?
I believe that 90% of physicians would say no.
And that is the case, but now you know early on who to work with and who not to work with. And bottom line is, it doesn't make any sense to work with a person who's not willing to respect and honor your belief systems.
On the other hand, I would say 99% of physicians
Yeah.
are pawns for the system. So only 1% are willing to work somewhat as well as they can outside the system.
Mm-hmm.
Those are the truly holistic physicians.
Yes.
And so from this, from my point of view, I've stated every week, I think, I know no chronic disease for which I would allow any conventional medicine.
That's
Not
right.
one.
That's
No
right.
surgery, no drugs,
Mm.
chronic. But in acute situations,
Yes.
how do you know what to do?
Ah. You see, that is a wonderful question. So let's say you're in your 40s or 50s and you're starting to have a little bit of chest pain. Now, there's a long discussion that can go with that, but is it dangerous? Do you need to go to the hospital? Can you just wait it out? How do you know exactly? Now, if you're a provider, obviously there's red flags and there's things that you would look through, like vital signs, for example, other a review of symptoms, so to speak. In other words, shortness of breath, nausea, vomiting, fever, cough. There's a bunch of questions that I would ask as a doctor. But if you're a patient and you haven't been trained in this and you're not feeling well for whatever reason, how do you know whether you need to go to the hospital or not?
And when they want to do, let's say they want to do an invasive procedure,
Mhm.
an IV exam of the arteries of the heart.
Mm-hmm. Or angiocath or something of that nature. Yeah. Mm-hmm.
And then, of course, in an acute situation, I don't think you have a choice if you want to go through the medical system.
Mm-hmm.
But I'm dealing with just such a patient right now, and my recommendation is a calcium score, which is the percentage, if you will, of calcium in your heart arteries compared to other people your age.
Mm-hmm.
Now, depending, it could be all over the place, anywhere from 1% to 99%.
Mm-hmm.
And once you know that, then you have an idea of how serious it is. But if it's even 30%, I would want to reduce it.
Absolutely.
And I would not reduce it with surgery, personally.
Yeah.
I've threatened for years to have do not open tattooed on my chest.
Mm.
I would not consider open heart surgery, even if I had 99% calcification in my arteries. It's just not an operation I'm willing to consider ever. So the only operation or alternative is chelation. And for many, many years, we have done it as an intravenous, EDTA.
Mm-hmm.
Chelation works very well. Now, it takes 6 months to 12 months to get it done,
Mm.
but it's better than a knife in your chest.
Well, if you think about it, what are the main tools of the conventional medical system? Drugs and surgery.
Yeah.
Then you've got psychiatry, which is a whole new.
Now, with appendicitis,
yes,
in my opinion, surgery is the option.
Exactly.
However, there are physicians who even just recommend bed rest with antibiotics.
Mm-hmm.
I would not prefer that.
I've seen a couple of cases of that, and they haven't been very good outcomes with the waiting, antibiotic and wait and see.
To me, appendectomy is one of the best long-term things to have done if you need it.
And that's a wonderful example, and a wonderful example of taking a medicine that can save your life is somebody with a terrible pneumonia, infection of some sort, or anything of that nature, and that's where the drugs can acutely do something really powerful and good, and that's okay. Another place where conventional medicine really shines, and this is where to be aware of, it is good to get a diagnosis through the conventional medical system. It is very good at using labs. There's other means and methods outside, but it's a good start. If you have symptoms or issues, or you're not sure what's going on, and you want to find out, then definitely find out. I mean, you don't want to play games with your health and life. Go to your doctor, the doctor that you like, preferably a holistic doctor. But if you just have your primary care doctor, you want to use your insurance, get the diagnosis. There's imaging studies, there's blood work, there is all sorts of things, all sorts of flows and criterias and tools to establish what is going on. Is it diabetes? Is it hypertension? Is it vascular problem? Yes, or so on and so forth. Once you know what the problem is, now there you don't have to a knee-jerk reaction into a conventional treatment. That is where the pause can come in, and you can actually, this is where this goes back to the informed mutual decision or consent with a patient. You can choose which treatments you find acceptable and which treatments you do not. And to make those decisions, it's really important to spend the time with a provider to understand why the decision is being made, not just, okay, well, it's he or she is recommending it, so it must be, I must do it. No, blind faith in the system is actually quite dangerous, as a matter of fact. Now, if you have a great doctor and you're not sure what to do and they're giving you good advice and you trust them, great. But if something in your gut, something is telling you, hey, this is not right, or you're doing something and it's going in the wrong direction, well, definition of insanity. Doing the same thing, expecting a different result.
Now, interestingly, depending upon all kinds of things, what are the most immediate needs, if you will, of a patient, other than an acute heart attack or a major infection or major injuries?
Major injuries. Okay. So in other words, acutely.
Acute. But for instance, is there any
Yes.
psychological problem for which you would accept a psychiatrist's orders?
Well, okay. In the hospital setting, and this is based on a policy and procedure. This is where the informed decision making and communication with the provider is really important. If somebody's suicidal or homicidal, then by law, by definition, we have to basically make sure that they're safe. Okay, commit and everything else to involuntary. Now, it's terrible for the person, but it may save their life and may save somebody else's.
Ready to go on the air?
Okay, well, and we'll continue talking, but we're joining the radio?
Yeah.
Proper, yeah. Shall we start from beginning, an introduction for those who haven't heard us?
A little bit.
Yeah.
Give us just a moment.
Mm-hmm. Actually, 38 minutes, not bad. Mm-hmm.
Vision Communications Incorporated, its management or advertisers. Vision Communications Incorporated is not responsible for the validity or accuracy of information presented on this program. Wellness Wednesday with Dr. Norm Shealy and Dr. Shealy-Sorin. Get the health answers you need from the creator of holistic medicine and the 2020 Holistic Doctor of the Year. To be a part of the show, call 417-447-1777. Wellness Wednesday. Now, here are your hosts, Dr. Norm Shealy and Dr. Shealy-Sorin.
As a patient, decide when and if to use conventional medicine.
Yes. And so there was a game. Went into,
It's over now, I guess.
it's over now. So now we are back on the radio, but we did start talking on the Facebook Live and YouTube Live. So you can catch us if you can find us there on what we've done so far. But just a quick summary of the concepts that we have discussed. Here goes. Basically, conventional medicine is good for acute medical care.
And for diagnosis.
For diagnosis of certain things.
That is,
yes.
I would say, in general,
Yes.
it's been known for years that just with a history at a physical exam, the average physician is going to make a diagnosis accurately 80% of the time.
Yes.
And by the time we do our laboratory tests, blood and that kind of thing, and x-rays of various kinds, we should be at least 99% certain of what our diagnosis is.
Basically, yes. And that's actually,
we've got a caller. Good afternoon.
yeah, we can take a call.
We're ready.
Yeah.
Good afternoon. You're on the air.
Dr. Shealy,
Yes.
I guess I had the wrong station on. This is your friend, Bob Mundy. How are you all doing?
We're
Bob.
doing great, Bob. What's up?
All right.
Well, I'm
Can you
going
get rid of
down.
the background noise, Bob? There's some kind of, it sounds like there's a fight going on in your background.
Oh, I'm sorry. It must be the road noise. I'll make her really quick. I know we can't talk a whole lot about the vaccine. I call it the jab. Would either one of you men take the vaccine for $10,000?
I wouldn't take it for $10 trillion
I'll
or $1.
I second the notion.
Okay. Just suppose if someone would come down, even with the Delta type, I'm hearing that the intravenous ozone will kill it. Is that something that we can even discuss?
Actually, no, we can discuss it because we'll be off the air entirely. But ozone, let me talk about the ozone, which is wonderful. Ozone is actually one of the best and one of the most amazing modalities for the viral, bacterial, and fungal. And we do this basically all day, every day in the clinic. And whoever else does it, God bless them, because it's one of the best modalities out there. And I'll recommend it for basically any kind of infectious or otherwise situation, but also to boost the immune system and just to clean things up in terms of blood and autoimmune and otherwise. Dr. Shealy.
Well, compare ozone with vitamin C.
Wonderful. Bob, I sure appreciate this question.
One last quick question. What would you tell your audiences, what minerals, vitamins, and whatever to maximize our immune system?
Yes.
I'll get off and listen. God bless you all.
Thank you. So the best way to optimize, and this comes back to the previous question, Bob, you did an amazing, you asked an amazing question, and it's wonderful to be able to answer it. Vitamin C is the best way to get larger amounts, up to 50 to 75 grams of vitamin C into your system, and that's one of the best immune supports that you can get. It also is the detoxifier. It's great for the liver. It's great for so many things. And again, it can be wonderful in terms of we can't say we treat cancer. We don't. We're not oncologists, but there's been a number of miracle stories on that. Ozone works is an O3 molecule. You split O2 oxygen and it becomes temporarily O3. In the medical setting, not in the environmental setting, in the medical setting, it's very safe, and you can treat the blood, you can treat the various aspects of the body. In other words, ears, nose, throat. You can treat the bowels. You can do a number of things, and it is if one were to be concerned with coming down with any kind of illness, infectious or otherwise, that would be the first thing that I would strongly consider.
I agree.
Yeah.
But you didn't answer my question. I'm going to push you.
Yes, please. Yeah.
The difference between vitamin C and ozone as far as essentials.
Yes. Ozone, basically vitamin C, literally, we take a solution of high doses of C together with B complex, magnesium, and lots of other things that make up a Myers cocktail, and we put that into the body. That is the key. And then it does the work. The ozone, I hope I'm answering the question from the right angle. There's so many angles here. Ozone is basically, we take your own blood out, we go put it through the ultraviolet, and then we also put it through the ozonation process, and then that blood that comes back is now basically has been treated, processed, and whatever the issues are in the body that's present in that amount of blood is then shared with the rest of the immune system. So that's why the combination is the best case scenario.
Good afternoon. You are on the air.
Hello.
Hello.
Hi. How are you?
Hi. Doing fine. Is this the doctor?
Yes, it is.
Hi. I had a question about thyroid.
Thyroid. Yeah.
I am almost 50 years old, and my hair is starting to thin, and it's really starting to concern me. And I've been reading a little bit, and on Dr. Shealy's site, I had read something about like your temperature, if it's low all the time. And my temperature, if I'm at 98.6, I have a fever. I'm always in the 97s and sometimes in the high 96s.
That is unequivocally hypo or low thyroid, yes.
Okay. So what is the best steps for me to take to find that out? I'm not big on going to a regular physician.
Well, see,
I don't want to get on their drugs.
Yes.
Well, the only treatment that I personally use is Armour thyroid.
Yeah.
I do not use levothyroxine, the artificial, if you will, thyroid. My experience is that 90% of the time it doesn't bring your temperature up. Now, the problem is if you live in Springfield, unfortunately, or any other city with fluoridated water, the blood tests for thyroid function are useless. You're wasting your money because the lab cannot distinguish, as your body cannot distinguish between fluoride and iodine. So you can make triiodo if you have the iodine, but it won't happen in Springfield. So you make trifluorotyrosine, which doesn't act as a thyroid molecule. So you need to see a holistic physician who will give you Armour's thyroid instead of levothyroxine.
And depending on where you are, you can also call us. We are in Springfield, 417-351-5221. So again,
Okay.
417-351-5221. I think I got it right. And they just ask for, this could be a focused
Focus
visit and ask for to schedule with either Dr. Shealy or myself, Dr. Sorin. Actually, interestingly enough, my last name is also Dr. Shealy-Sorin right now. So it's
your license change yet?
Working on it. Yeah, but it's in well, to say the least. I mean, it's about time somebody honored this man with a continued legacy of what he does. But anyhow, I'm sorry, but go ahead, please. Do you have any questions otherwise?
No, that's the one thing. I just want to get this figured out before I go bald.
Oh God, yeah, absolutely, and many other things. The hair is only one of the many organ systems that's involved in thyroid. It's a master hormone.
Okay. I appreciate the information, and I'll make an appointment with you all.
Great.
Wonderful.
Thank you for calling.
All right, thanks.
Yep. Did we want to talk about? Let's see. Actually, in the first half of the show, we started with something really good. And I wanted to make sure that the listeners, and I'll repeat this one more time, but if you have a disagreement or if you have a difference of opinion with the conventional medical system, whether it be a doctor, provider, nurse, or whatever, healthcare system, bureaucracy, how do you disagree? How do you voice your opinion? And how do you make sure that what matters to you is honored? And there's a key word expression. Most people don't realize they have this power. First of all, and I said this before, your medical records are yours. You can share them with the provider of your choice. Nobody can keep those away from you. That's number one. Number two, your health information and privacy is yours. Nobody's allowed to get into your private health life unless you choose to disclose that. So we forget that. That's number two. There's still the freedom of health and being you, and it's still there. Number three, I got to be careful not to get too deep in here, but number three, if you happen to disagree with a healthcare provider or they're pushing something, and we gave an example of a drug like a statin drug for cholesterol or otherwise, the key word you can say to the provider is as follows: thank you for your perspective. You can feel free to document the discussion. I acknowledge what you're saying, but here's the key word. You can skip all of the above as long as you say this: informed decision making. This is this is my choice. This is how I feel. Are you willing, or are you able to see me as a patient, continue the relationship if we happen to disagree on this topic? And you will know immediately if this is somebody you can work with or you will not. There are several categories of people out there. Some have to follow the rules and guidelines, otherwise they get fired. And that's basically all of the industry is, what's the right word? It's a radio, I can't say it out loud. Compromised from top down. Okay, that's one thing. But some people also get overzealous and they take it on their shoulders to do certain things that they feel is absolutely right, and they have to enforce it on everybody. So if you're working with such an individual, they may be right, they may be wrong, but again, their opinion doesn't have to become your reality. So how do you say no? And again, you'll know by asking that question or something similar to that, whether you're going to be able to work with that provider, that doctor, that person. And if not, then find yourself somebody who is willing to listen, preferably a holistic provider.
And if they don't mention holistic, they're probably not the alternative you need.
Yes.
Now, I do want to say, for instance, at the top of my list of under no circumstance would be the statin drug.
Right.
That is absolutely unacceptable to me under any circumstance whatsoever. And so it has to do with almost everything related to cholesterol. But statin drug kill your brain in the long term.
And the heart.
Well, but they start with the legs and the heart,
Yes.
but they eventually get the brain. And that's the central control system. So under those circumstances, when I take a statin drug, I can keep your cholesterol healthily normal 100% of the time without a statin drug.
Exactly. And then,
But the same is true with hypertension.
yes.
I don't know a hypertensive drug that doesn't suck your life energy. Eventually, it's going to make you fatigued, if not at the very least, as well as everything else. And so, in general, it's the chronic use. Beyond an acute illness, now most acute illnesses, if you're going to get well, you're going to get well within a month. If you're not well within 3 months, you're probably not going to get well from that particular thing.
And that is when the decision has to be made. Are you willing to do what is necessary from the ground up? Lifestyle, so nutrition, supplementation. By the way, at some point, let's talk about supplements, because there was a question about that. Yeah. But bottom line is, make a decision. You got to make a decision which way you want to go. Are you willing to go the route of the conventional healthcare system, which is, I wouldn't even call it healthcare system, conventional medical system, or are you going to be proactive and take care of your health in the way that you can?
Well, to me, the places of medicine that are absolutely unacceptable are the treatment of cholesterol and the treatment of hypertension and the treatment of anxiety and depression.
Absolutely.
Those are the things that are far, far safer and better, more successfully treated with holistic medicine.
But same goes with every other chronic illness I can name.
Well, it's true. Like cancer, for instance.
Yes.
Since the beginning of chemotherapy, I've said under no circumstance would I consider chemotherapy. I don't mind dying. I just don't want to be poisoned to death. And the evidence to me is overwhelming that the average success rate of chemotherapy is extending your life about 4 months. Well, 4 months is not worth 6 months of torture.
Well,
is the way I look at it.
According to the first oncologist who came in when I was diagnosed with colon cancer in 2007, I had 2 years to live. So by 2009, I was supposed to be dead. I'm here, but not because of anything done conventionally, because I changed who I was. I changed my lifestyle. I changed my thought pattern. I became holistic. And thank God I'm practicing it right now as well.
Now, let's talk about basic supplements, because I think that is critically important.
Yeah.
And basic supplements, in my opinion, at the top of the list is vitamin D3. If you weigh under 140 pounds, it's 50,000 units the 1st, 10th, and 20th of every month. If you weigh over 140 pounds, it's 50,000 units once a week for the rest of your life. If you ever feel as if you're developing a viral illness, you know what that means. Then you take 150,000 units 3 days in a row, then you go back to your regular routine. Secondly, you need a good B complex, especially in today's polluted world. And that best B complex, in my opinion, is the Shealy-Sorin Green Essentials, 2 to 4 a day. And you need adequate vitamin C, and the best is Shealy-Sorin Youth Formula. You get 2 grams of vitamin C, 1 gram of MSM, and a little bit of beta-glucan. That is the best form of vitamin C, and it's good for your immune system. Now, those are the absolute essentials. Now, one of the others that I really like is Astaxanthin. Astaxanthin is a broad antioxidant, broader than any other single one that I know of. So, for the average person, 10 milligrams a day is adequate. I take 30 milligrams because I like it. It's that safe. So, those are essential. Now, if you need supplements, where are you going to get them? Well, you can get them from our website, of course, realholisticdoc.com. Or right here in Springfield, you go to Spring Valley. Just walk in and tell them what you want. They'll have it for you. I like Spring Valley because, well, the service. I want to know that I'm getting the right thing. I don't want to have to search through 10,000 things to find what I want. I want the store to tell me what to get. If I ask for Echo Green, they should give it to me. And they will. And so that's why I recommend Spring Valley. They carry all of our goodies. It is the place where I shop, and you should too. Now, there's one other thing. The average American is getting far too few fruits and vegetables. They average 2.2 servings a day. You need 8 to 10 to be healthy. Now, if you're not going to use 8 to 10 servings of fruits and vegetables, then especially then, take Nature's Bliss tart cherry juice concentrate. Nature's Bliss tart cherry juice concentrate. You find it only at a real grocery store. And I personally take 2 tablespoons a day, but 1 tablespoon a day at least will give you the equivalent of 3.7 servings of fruits and vegetables. So you get almost to normal. And it can't hurt you to take 2 tablespoons. It's excellent. It tastes good, lowers your cholesterol, lowers your blood pressure, anti-inflammatory, and there's nothing that equals that much in a single tablespoon or 2.
Oh, I agree. Plus, as you said, tastes great. So that's well.
So those are absolutely essential. Now, in addition to thinking about these kind of things, you need to move. The average person today, the average is 90% of people do no physical exercise. If you do no physical exercise, you have the same death wish as someone who smokes 2 packs of cigarettes a day. That's the same thing. It's equivalent. So if you smoke and sit all day, you decrease your life expectancy by about 18 years. At any rate, all of these things are critically important for you and your lifestyle. And well, you are the only person who can make a decision. I'm told that she says we've got only a couple of minutes to go. I thought we started late. But
We did. We can continue on to the next hour if you'd like. However you guys would like.
We can go for a few minutes. We'll see what the questions are. But, I just wanted to emphasize a few things, few key points. And then this is a little unusual, Ray, with a game and getting, into some of the radio time. But, I think we'll just go for a few minutes. And then if no questions, then we'll,
right. Let's just be sure we have questions to be answered before we turn off. Sure.
Mm-hmm.
What do I see here? You're looking at chat here. Oh, okay.
We got something?
Yeah.
All right, let's do it.
Right.
All right.
Modern technology at its best.
Okay.
Good.
For an annual physical, what blood work do you recommend having done?
I like a CBC, a comprehensive metabolic profile, and especially a high sensitivity C-reactive protein.
Wonderful.
In addition,
fasting lipid panel, if they haven't have that, thyroid panel, TSH, free T3, free T4. I always get hemoglobin A1C for catching early diabetes or any kind of sugar abnormality or metabolic syndrome. And from time to time, if there's an appropriate vitamin D levels and homocysteine levels. That's the basic, I think. And sometimes hormone levels if it's indicated. I work with the hormones quite a bit. Yeah.
Okay.
Mm-hmm.
Another question we have from the Facebook is, do you offer plain vitamin C IV at your clinic without anything else in it?
no.
You cannot.
You must, that's not safe. You must give it with Myers cocktail because vitamin C is going to drain out of you as it detoxifies your body certain vitamins and minerals that you must have in a Myers cocktail. I have done this, by the way, for well over 40 years safely.
And actually, I just want to say something. Our IVs, in other words, between the ozone and vitamin C, or the combination of the above, we're seeing quite amazing benefits with people for anything from, severe chronic issues. Again, not saying we're curing cancer, but miracles do happen. So please continue. Yes, any other?
This person just said, your thoughts on blood transfusions given the, quote, new normal.
The blood transfusion considerations given the new normal. Well, let's put, okay, how do I do this new normal? It's not normal. I'm going to stop there. Okay, please read between the lines. It's anything but normal, and it's never going to be normal the way things are going. Okay, trajectory. That's one. That's the end of that one. Please read between the lines. Blood transfusions, if it's indicated, if it's life-threatening anemia or a bleed, just treat it the same way it's been treated before. If it's necessary, It's it's a very clearly guided process with very check marks and safety margins and all that stuff. So the hospitals do a pretty good job making sure you don't get any contaminated blood for the most part. I wouldn't worry about that if you needed that truly.
Okay.
Mm-hmm.
Another comment said, I usually ask for a D3 and glutathione. What do you think about those?
D3 glutathione levels or glutathione
It
injections?
doesn't say. It just
Okay.
says, I ask for D3 and glutathione.
Well, if you're taking the amount of D3 I've already mentioned, you probably don't need a D3 level. But glutathione, I love glutathione. I think if you're really healthy, you make your own, but I'm not opposed to taking up to 1,000 milligrams a day of glutathione as a supplement if you like it.
As a matter of fact, whenever we do the IV vitamin C, if it's not a contraindication, it's very rarely it is. Glutathione is given.
And that's it for
Questions
for Facebook right now.
Well.
Okay. Well, I guess then, if you have more comments or whatever, or you need to talk with us, get in touch with us at the clinic, 417-351-5221. And until next week, have a healthy week.